Good afternoon. Thank you for being here. My name is Olivia Lorenz, and I'm excited to introduce A Clear Path Forward, which is a community-based initiative designed to support older adults in understanding and completing advanced care planning. I'll be walking you through the background, goals, implementation plan, and how we would evaluate success, all with the hope of sparking conversation about how we can bring this initiative to your community. Advanced care planning is a component of patient-centered care that enables individuals to document their medical preferences before a crisis occurs. In many communities, older adults often face challenges that lead to low ACP completion rates. The most prominent of these challenges are low health literacy, lack of awareness, and limited access to legal or healthcare support. These barriers have serious public health implications, such as leading to care that's not reflective of personal values, the increase of healthcare costs and caregiver burden, and ultimately, it'll worsen the disparities in the access and equity of healthcare. So, addressing this gap is really essential for individual autonomy, but also for promoting health equity, improving end of life care quality, and supporting more responsible healthcare use. All right, so advanced care planning is a very broad term that encompasses a wide range of legal documents. I just wanted to introduce you to the five most common types of ACP documents that are most likely going to be included in this workshop. This includes living wills, durable power of attorney for healthcare, medical orders for life sustaining treatment, do not resuscitate orders, and organ and tissue donation consent. Okay, so when exploring the idea of an advanced care planning workshop for older adults, I conducted a review of the current literature that's available on this topic, and I found three important themes that helped to guide me when I was planning this initiative. The first one being that community-based and peer-facilitated ACP initiatives increases comfort, participation, and trust, particularly among older adults that are underserved. So, peer-led workshops can create a non-clinical and relatable environment that reduces intimidation and stigma that often comes with these kind of conversations. Compared to provider-led approaches, peer approaches are scalable, lower cost, and that just makes them more well suited for widespread community use. The second theme is that structured facilitator training enhances equality. So facilitators play a crucial role in shaping the conversations surrounding ACP. The studies show that evidence-based training programs significantly improve facilitator confidence and knowledge when navigating these sensitive topics. So interventions using active learning methods like role playing, case discussion, and feedback provide better long-term retention than passive approaches such as just lectures. And then the last theme that I want to explore is value-based communication supports person-centeredness. So there's an emerging trend in the ACP literature, and it's the shift from slowly going from directive-focused planning towards value-based communication. So rather than asking these individuals to make decisions about specific treatments, this approach tries to see what is important to the patient, such as like maintaining independence, avoiding prolonged suffering, or supporting their family harmony. So, studies show that this kind of conversation resonates more strongly in authentic engagement by emphasizing personal priorities instead of hypothetical medical scenarios. Value based ACP encourages more holistic, meaningful planning and better prepares the surrogate decision makers. All right. So, only 50% of older adults have completed some kind of advanced care planning, with even lower rates among underserved populations. Barriers like low health literacy and lack of access lead to misaligned care, caregiver stress, and health inequities. So these statements really capture the problem that's surrounding ACP participation. So, based on this problem, I've created three goals that have kind of been the guiding force for this program. So the first goal is that by the end of the workshop, at least 80% of participants will demonstrate improved understanding of key advanced care planning concepts as evidenced by scoring at least 70% on a brief post-workshop knowledge assessment. My second goal, by the end of the workshop, at least 70% of participants will report increased confidence of discussing their care preferences with family or healthcare providers as measured by a self-reported survey, as well as the ability to identify at least 2 individuals that they intend to initiate a conversation with. And then the last goal, within 1 week of attending the workshop, at least 80% of participants will complete one advanced care planning document with support from trained facilitators and access to legal and notary services provided on site. All right, so as we're moving forward, we can begin to assess the proposed interventions. So the workshop's going to be held at a trusted community location. This can be a senior center, a church, or a housing complex. To gain awareness for the workshop, community-driven outreach will be used. So this includes partnerships with local healthcare institutions, housing authorities, and faith-based organizations. The flyers and promotional materials will utilize plain language and they can be translated as needed. The workshop is going to be 2 to 3 hours long, and it would consist of a group learning session from the trained facilitators, including social workers, community health workers, and legal support volunteers. And during the group learning session, participants would be introduced to the concepts of ACP and its importance, along with an overview of the key documents that they're going to be completing. So during this group session, they're going to do value-based reflections, so through guided worksheets and visual prompts, as well as real-life storytelling, things like that. And then within 1 week, the participants will receive a follow-up or a call to encourage continued discussion with family members and providers and offer support for anything that they didn't get done during the workshop. Okay, so my project here is guided by the Anderson's Behavioral Model of Health Services Use. This model identifies 3 categories that influence whether individuals engage in health-related behaviors. The first being predisposing factors, second, enabling resources, and lastly, need-based factors. So the intervention targets predisposing factors by using plain language education that improves understanding and changes beliefs about ACP. It strengthens enabling resources by providing on-site legal support, trained facilitators, and notary services to help the participants complete the documents. And the workshop also addresses need factors by focusing on older adults who may have an increased urgency to complete these ACP documents. So by using Anderson's model, the intervention was intentionally designed to remove access barriers and increase health system navigation support and empower informed decision making. Moving on to stakeholders. So the key stakeholders in this initiative include internal stakeholders and external. Our internal stakeholders are the older adult participants, the workshop facilitators, and then the external stakeholders are the community organizations and the legal aid and the notary services. So each one of these stakeholders have different needs, and we've developed strategies to improve engagement for each of them. So for the older adult participants, we're going to communicate with them with plain language and large print and things that can be translated as needed. So we're going to use materials like flyers and verbal invitations, and these are going to be shared through community members. Also, participant representatives can be included in the planning process. So moving on to workshop facilitators. So communication with the facilitators is going to be regular meetings and email updates that discuss planning and training. These stakeholders, they will assist with the planning by sharing their experiences working with these underserved populations, and the feedback after the workshop will aid in shaping further interventions and improving further delivery. So moving on to the community organizations. So we're going to establish partnerships with them through email, phone, and in person. We're going to provide them with flyers and talking points and promotional materials for the outreach. These organizations are going to be involved in the planning because they're going to help choose dates and times for the workshops and also kind of tell us what adaptations are needed to best serve their clients. And then lastly is the legal aid and the notary services. So the communication with them is going to be clear outlines of the commitment that's involved, expectations, time, things like that. And then these professionals are going to collaborate with us on how to support the legal completion and make sure that it's aligned with state regulations. All right, so the workshop has been broken down into 4 phases of implementation to make things a little bit more palatable and kind of easier to follow. So the first phase is planning and preparation. So this will be identifying and confirming the workshop location, building an interdisciplinary team, developing the ACP materials and agenda. This will be securing funding and donations and promoting the event. This will probably take about 2 to 3 months. Phase 2, recruitment and registration. We're going to be distributing flyers, identifying potential participants, conducting interest surveys to understand participant knowledge and barriers, and we're going to begin registering the participants and gathering basic demographic information. This will also take probably about 2 to 3 months. Phase 3, which is workshop delivery. So we're going to facilitate the workshop. We're going to include the ACP education, the storytelling, the group discussions, and the guided form completion. We're going to be providing emotional support and one-on-one assistance as needed. This will probably take about 2 to 3 weeks. So the last phase is follow-up and evaluation. So we're going to follow up with the participants to finish reviewing the documents and answer any outstanding questions, collecting feedback through surveys and interviews, debriefing with the team to identify successes and improvements for future workshops. This will probably take about 1 to 2 months. All right, and then here is a Gantt chart that kind of shows the layout of our estimated times for each phase. Okay, so to implement this workshop, several resources are going to be required. So the first one is personnel. So we're going to need the trained facilitators, legal aides, notary service, and probably a few volunteers. We need educational materials, which are easy to read handouts, the ACP forms, and visual aids that are designed for low health literacy populations. We need some basic supplies like pens and folders, clipboards, and light refreshments. And then we also need to secure the facility. So this would be within a trusted community location. The intervention would require small-scale funding through something like a grant or community donations. So throughout the planning of this project, I've identified 3 potential barriers in meeting the goals that we've set for the initiative. With each barrier, we've developed some solutions to overcome them and how to move forward. So the first barrier is mistrust or fear surrounding ACP conversations. The solutions that I've came up with are building trust through culturally sensitive facilitation and storytelling involving familiar community leaders on validating the importance and reducing stigma with these conversations, emphasizing personal values and autonomy rather than using like medical jargon or clinical processes. Second is low health literacy or difficulty understanding ACP forms. So my solution to this would be using visual aids and plain language materials designed for someone who's 6th grade reading level or even lower, offering one-on-one assistance during the workshop and during the follow-up, and provide translated materials where they're needed. We would reinforce key concepts through group discussion and real-life scenarios. All right, and then the last one would be limited resources for hosting or for follow-up. My solution to this would be partnering with local organizations such as faith-based groups or a local area agency on aging to access donated space and support services. We could seek small grants or donations to cover like printing and refreshment costs. We would also keep the follow-up efforts inexpensive by using phone check-ins and volunteers. Okay. So for evaluating the effectiveness of a clear path forward, we have both qualitative and quantitative methods. So qualitatively, I would do open-ended surveys and follow-up phone interviews to explore participants' experiences, their perceived barriers, and their emotional responses. These methods would help identify whether the workshop fostered a safe and trusting environment. And then quantitatively, we would use a pre and post workshop survey. So for the metrics for the evaluation, they are the same as the goals that I mentioned in the beginning, the three initial goals. So they would be looking at the understanding of key ACP concepts. They would look at confidence, discussing care preferences, and ACP document completion. So throughout this project, it's really deepened my understanding of the real world challenges that older adults, especially those in older or underserved communities, are facing when it comes to advanced care planning. I learned how to navigate these conversations and how important it is to approach them with cultural sensitivity, clarity, and compassion. This experience really affirmed my passion for working with older adults and in the public health kind of sector. I feel more committed to pursuing a career where I can bridge the fields of therapy and public health, whether that's through education, advocacy, or direct care. So thank you for taking the time to learn about a clear path forward. I really believe that this initiative has the potential to make a meaningful impact by empowering older adults to take ownership of their future care and by bridging gaps in trust, access, and understanding. I really welcome your thoughts, questions, or opportunities to collaborate as we can consider how this model might be right for your community. Thank you so much and have a great rest of your day.